So with the use of ReSure Sealant in combination cataract cases, the ones I typically are MIGS with mix, and with the microincisional glaucoma procedures, specifically the eye stent. At the end of the procedure, you have to worry about hyphema and bleeding. You don't want to see the patient post-op day one with an eye full of blood. And so what we do is at the end of the case, we use ReSure, make sure that chamber is well formed and sealed, and the eye's not super soft, so you get that little micro bleed that continues through the evenings. I use the mixed incision, 1.8 to 2 millimeter micro incisional cataract surgery routinely. You think those would seal every time, and they don't always seal every time. And sometimes you have a patient who's a diabetic or has other risk factors, such as MRSA risk, and so we want to make sure that incision is well sealed. Those are the type of patients I use it on. If the wound's leaking, then you got to seal it. And the incision has to be dry when you put the ReSure Sealant on, so there are a couple tricks. If you can't get the incision to stay dry, we'll actually let the chamber shallow, dry, seal it, or I put an air bubble in the anterior chamber that keeps from leakage, and then I can use the ReSure Sealant. So that's what I do with my clear cornea cataract surgeries at ReSure. Yeah, well, I use the ReSure Sealant specifically in a case where I have a patient traveling a long way in a co-management case with an optometrist, and the last thing I want to do is come back to me. I'm in the middle of a case. Unfortunately, we had a capsule break. And you want to reduce that risk for infection. Procedure turned out well, but you don't want to have to put that stitch in, and then now the patient's going to have to travel another 2.5 hours to come back to have that removed in the future. So that definitely saved me, saved the patient, and probably reduced the risk for infection that much more, because we know in the clinical study, ReSure Sealant outdid suture anyway.